Hey everyone, and welcome back for another deep dive. Today we are going to tackle a topic that's pretty complex, but also super important to understand.
It really is.
We're talking about the hypothalamic-pituitary axis. It's often called the control center of the endocrine system.
It's a fitting nickname for sure.
We've got some excerpts from a medical text to help guide our conversation so we can really get into the nitty-gritty.
Excellent. I'm ready to dive in.
All right, so let's start with the basics. What exactly is the hypothalamic-pituitary axis?
Well, it's essentially the link between your brain and your endocrine system.
Okay, so the endocrine system is like all those glands that produce and release hormones, right?
You got it. And the hypothalamic-pituitary axis is how the brain communicates with and controls those glands.
So the hypothalamus acts as the brain of the operation.
Exactly. It's constantly gathering information from your body and deciding what hormonal adjustments need to be made. Then it sends out signals to the pituitary gland, which is kind of like the command center.
I see. So the hypothalamus calls the shots, and the pituitary carries them out.
You could say that, yes.
So where exactly are these two structures located?
They're both located in the brain, but it's a very small area.
How small are we talking?
Well, the pituitary gland itself is only about the size of a pea.
Wow, that's tiny. And it's controlling so much.
Right. And the hypothalamus is right above it.
So they're neighbors.
Close neighbors, yep. And they have a very special relationship.
Oh, how so?
Well, the pituitary gland is actually made up of two parts, the anterior pituitary and the posterior pituitary.
Two parts. Do they do different things?
They do, yeah. They have different functions and even develop from different parts of the embryo.
Huh, that's interesting. So how do they communicate with the hypothalamus? Is there some kind of special messaging system?
There is. It's called the portal system.
The portal system?
Yeah. It's a network of blood vessels that directly connects the hypothalamus and the pituitary gland. You could think of it like a dedicated delivery service just for hormones.
I like that analogy. So why is this portal system so important?
Well, for some hormones, it's all about timing and concentration. For instance, GnRH, which controls the reproductive system, needs to be released in pulses to work properly. If GnRH were constantly high, the pituitary would become desensitized to it. The portal system ensures those pulses get through without being diluted or delayed.
Ah, that makes sense. So it's like a carefully timed message.
Exactly. And this intricate communication is so vital that even a small disruption can have big consequences.
So what happens if that connection gets cut off?
Well, that's what we call pituitary stalk section.
And the pituitary stalk is what connects the hypothalamus and pituitary.
Right.
So I'm guessing severing that connection isn't good.
You're right, it can have some dramatic effects. The posterior pituitary pretty much shuts down because it depends on that direct neural connection from the hypothalamus.
Oh, wow. So essential hormones like vasopressin, which regulates blood pressure, can't get where they need to go.
Exactly. But the anterior pituitary, it's a bit more resilient. It has this alternative blood supply through what's called the inferior hypophyseal artery.
So to have a backup plan.
Sort of, yeah. It keeps the anterior pituitary alive and lets it respond to at least some hypothalamic hormones as long as their levels are high enough in the general circulation.
Interesting. So it's like a lifeline, keeping things running at a bare minimum. But I'm guessing it's not business as usual, right?
No, not quite. The function of the anterior pituitary is definitely affected. Most of the hormones it produces, like the ones that control your thyroid and adrenal glands, plummet.
Oh, so that's not good.
Not good, no. But there is one hormone that does something rather unexpected. It actually increases after pituitary stalk section.
Really? Which one is that?
Prolactin.
Wait, prolactin. That's the hormone responsible for milk production, right?
That's the one.
So cutting off communication actually makes one hormone level go up. That's so strange.
Yeah. It is counterintuitive, isn't it? But remember, the anterior pituitary develops differently from the posterior pituitary. It functions more like a separate gland, under the brain's control, but not directly wired into it.
So it's not just following orders from the hypothalamus?
Not exactly, and that plays a role in this prolactin puzzle. You see, normally the hypothalamus sends signals to the anterior pituitary to inhibit prolactin release. But when the stalk is cut, those inhibitory signals are gone. And without that brake pedal, prolactin production goes unchecked.
So it's like the body's way of adapting even in a crisis? That's pretty clever.
It is, and this helps explain something we see in patients with certain pituitary tumors.
Oh. You mean like if the tumor's pressing on the pituitary stalk?
Exactly. Even if the tumor itself isn't making prolactin, that pressure can mimic the effects of stalk section, leading to increased prolactin levels.
So it's like the tumor is accidentally pressing the prolactin accelerator pedal. Wow, that's fascinating. So we've got physical damage to the stalk, but I'm guessing there are other things that can disrupt this delicate balance.
Absolutely. Yeah, there are a bunch of things, actually. Things like stress and certain medications can also interfere with the hypothalamic-pituitary axis.
Okay, well, I know I'm definitely no stranger to stress, so let's start there. How does stress mess with this system?
Well, when we're stressed, our brains release this hormone called CRH.
CRH?
Yeah, it stands for corticotropin-releasing hormone. Catchy name, right?
Not so much.
But anyway, the CRH is like a signal flare. It tells the pituitary gland to release another hormone called ACTH, or adrenocorticotropic hormone, and that's the signal for your adrenal glands to produce cortisol.
Which is the stress hormone.
Exactly. So it's like a chain reaction. CRH triggers ACTH, which triggers cortisol. And in the short term, it's a healthy response. It helps us deal with those fight or flight situations.
Right, like when you're about to give a big presentation or you're running late for something important.
Exactly. But the problem is when that stress becomes chronic, when those cortisol levels stay elevated for a long time, it can start to have some negative effects on our health.
Yeah, I've heard that chronic stress can lead to all kinds of problems like weight gain and insomnia and even a weakened immune system.
Hmm.
Is that because of the constant cortisol surge?
It definitely plays a role. High cortisol levels, especially over an extended period, can disrupt a lot of the body's normal processes, including the hypothalamic-pituitary axis itself.
Oh, so it's like chronic stress can actually damage the system that's supposed to be helping us cope with stress.
That's a good way to put it. It can become a vicious cycle.
Okay, so we've got stress messing with things. What about those medications you mentioned? How can they interfere with the hypothalamic-pituitary axis?
Well, some medications can actually mimic the effects of cortisol, like corticosteroids. They're often prescribed for inflammation.
Oh yeah, I've heard of those.
And while they can be very effective in treating inflammation, they can also suppress the activity of the hypothalamic-pituitary axis.
So it's like the medication is telling the body, hey, I got this. You can take a break from making cortisol.
Yeah, something like that. But then when you stop taking the medication, the hypothalamic-pituitary axis has to kind of wake back up and start producing its own cortisol again.
I see. And that can be tricky.
It can be. That's why it's so important to taper off these medications slowly, under the guidance of a doctor, to give the body time to adjust.
Okay, so we've got stress, we've got medications. You also mentioned lifestyle choices. What kind of things are we talking about there?
Well, things like not getting enough sleep, having a poor diet, not exercising enough. All of these things can contribute to hormonal imbalances and disrupt that delicate balance of the hypothalamic-pituitary axis.
It sounds like taking care of our overall health is really crucial for keeping this system functioning properly. Like what we eat and how much we sleep and whether we exercise, it all matters.
It really does. It all comes back to that concept of homeostasis, that natural state of balance that the body's always striving for.
Right, right.
And when we make choices that support our overall health, we're essentially helping our body maintain that balance.
So it's not just about avoiding specific things that can mess with the hypothalamic-pituitary axis. It's also about actively doing things that promote its healthy function.
Absolutely. It's a two-way street.
This is so insightful. I'm starting to realize just how interconnected everything is. Like, it's not just about individual hormones or glands. It's about the whole system working together.
Exactly. And that's why it's so important to understand how this system works and what can affect it, because it really can have a ripple effect on so many different aspects of our health.
So let's say someone is experiencing some symptoms that might be related to a problem with the hypothalamic-pituitary axis. What kinds of tests can doctors do to figure out what's going on?
There are actually quite a few different tests they can run.
Like what?
Well, blood tests can measure the levels of different hormones that can give doctors clues about what might be going on.
So it's like getting a snapshot of what the hormones are doing at that moment.
Right. And then there are imaging studies like MRIs, which can help visualize the pituitary gland itself.
Oh, so they can actually see if there are any structural abnormalities.
Exactly. So it's really a combination of looking at the symptoms, checking hormone levels, and getting a visual picture of the gland itself.
It sounds like it takes a bit of detective work.
It can, yeah. But it's important to have a healthcare provider who can put all the pieces together and make the right diagnosis.
Absolutely. So let's say a diagnosis is made. Are there treatments that can help restore balance and improve symptoms?
Oftentimes, yes. It really depends on the underlying cause.
Okay, so what are some of the options?
Well, sometimes it's as simple as lifestyle modifications, like improving sleep habits, managing stress, making dietary changes.
Ah, so those healthy habits we were talking about earlier.
Exactly. But in other cases, medication might be necessary, or in more severe cases, surgery might be required.
I see. So it really runs the gamut.
It does. But the good news is that there are options available. And the earlier a problem is diagnosed, the better the chances of successful treatment.
That makes sense.
Hmm.
Well, this has been incredibly eye-opening. We've covered a lot of ground today, from the anatomy of the hypothalamic-pituitary axis to its intricate functions and some of the things that can disrupt its balance. And you mentioned earlier that we've only just scratched the surface. So before we wrap up, I'm curious to hear what some of the areas are that researchers are still trying to figure out.
Oh, there are so many exciting avenues of research right now. It's a really fascinating field.
Well, with so much to consider, I think it's a good time to pause and recap what we've learned. For listeners who are maybe just tuning into this topic for the first time, what are some of the key takeaways about the hypothalamic pituitary axis?
I think the biggest thing to grasp is that this tiny system is vital to our health and well-being. It's not just about regulating hormones, it's about keeping our body in balance.
It's like that old saying, everything in moderation.
Yeah, exactly. It's all about maintaining that delicate homeostasis that lets our body function at its best. And I hope listeners are walking away with a deeper appreciation of just how complex and interconnected the system is. It's constantly receiving information from the brain and then sending out signals to the rest of the body to keep everything running smoothly.
It's like a conductor making sure all the instruments in the orchestra are in tune and playing together.
That's a great analogy. And just like a conductor needs to be aware of every section of the orchestra, the hypothalamus needs to be constantly monitoring feedback from the body to make sure everything is in sync. But as we've talked about, there are lots of things that can disrupt this harmony. Things like stress, certain medications, and even our lifestyle choices.
Right, it's a reminder that we can't just think about our health in isolated compartments. What we do in one area of our lives can affect this delicate balance and have ripple effects throughout our whole body.
Absolutely, and I think that's a powerful takeaway. We have a lot more control over our health than we might realize. By making choices that support that delicate balance of things like managing stress, being mindful of the medications we take, and creating healthy lifestyle habits, we're giving our bodies the best chance to function at their best.
We're empowering our inner conductors, so to speak. Well, we've covered so much ground today, from the anatomy and function of this fascinating system to the many things that can impact it. And like you said earlier, we've really only scratched the surface. There's still so much more to learn.
There really is. The research is ongoing, and every day scientists are learning more and more about how the hypothalamic-pituitary axis works and how we can use that knowledge to improve lives.
It's amazing to think about all the possibilities. It makes you realize just how much we still don't know. But I think we've given our listeners plenty to think about for now. Hopefully they'll walk away with a newfound appreciation for the amazing complexity of their own bodies and a desire to keep learning more.
I hope so too. It's been a pleasure diving into this topic.
It really has. And a huge thank you to you for sharing your expertise with us. To our listeners, thanks for joining us for this deep dive into the hypothalamic pituitary axis. It's such a fascinating and important topic. Remember, knowledge is power. The more we understand about our bodies, the better equipped we are to take charge of our health and well-being. So keep exploring, keep learning, and we'll catch you on our next deep dive.